This Your Health, Your Decision special on women's health is brought to you by Conway Medical Center and WPDE News Channel 15.
Hello, I'm Allison Floyd, and welcome to this Your Health, Your Decision 30-minute special talking about women's health issues. Over the next 30 minutes, we're going to talk about everything from screenings to diseases that women of every age need to know about. We are joined now by OB/GYNs from Conway Medical Center. We have Dr. Jessica Lukowski, Dr. Nancy Collins, and Dr. Kenneth Thompson. Thank you all for being with us. Dr. Lukowski, we'll start with you. Every woman needs gynecological exams every year, and one of the screenings you perform are clinical breast exams. Why are those so important, and what do women also need to know about self-breast exams?
Well, what we recommend for women who are 21 to the age of 39 is annual breast exams either every 1 to 3 years. Typically, when women come in for their annual gynecology exam, we tend to do the breast exam. So most of our patients are getting those yearly. And that's very important because it's important to look for anything like lumps or skin changes that they may have not otherwise noticed. As far as self-breast exams, that's not something that's really recommended the way it used to be. Now the recommendation is more focused on breast self-awareness, so that women just get an idea of what is normal architecture, the normal architecture of their breast, so that if something does arise that's unusual or new to them, that they will notice that. But as far as a systematic breast exam, that's not really a recommendation for patients now.
Dr. Collins, moving to STD screenings, women in this age group, what do they need to know about that?
Well, the current ACOG guidelines recommend that, and ACOG is the American College of Gynecology, recommend annual screenings for sexually transmitted infections in patients up to age 25. And in addition to that, continue that on in any patients who have high-risk sexual behavior, patients with multiple partners or partners with multiple partners. That would increase your risk of exposure. Those are the screening guidelines at this point.
Dr. Thompson, talking about cardiovascular health, and a lot of people may not realize that more women die of cardiovascular disease than men. What's important for women in this age group to remember, particularly with blood pressure screenings and cholesterol screenings?
You know, blood pressure screenings, you're going to start at your annual exam, and you'll get those once a year, okay? The whole key to blood pressure is keeping it normal. If you keep a blood pressure in the normal range, you're going to be okay. If you have hypertension and you get that blood pressure in the normal range, you're still going to be okay. The concern is if you have undiagnosed hypertension, or if you have untreated hypertension, what can happen is you can damage all the end organs. You know, the end organs being the kidneys, the eyes, the brain. And so what you want to do is get blood pressure under control. The way you're going to do that is know if you have hypertension at all. So once a year, you're going to get that blood pressure screening, more often if it's abnormal and needs adjustment. Cholesterol. Cholesterol, what we do, it's a debate. Different groups say different ways. Some say start at age 45 and do it every 1 to 5 years, depending on the results. Some say starting it at as early as age 20. And it you kind of look at a patient and determine their risk factors, whether or not they have a family history of it, and determine when you want to start it.
So that's something that patients should discuss with their doctor?
Oh yes, definitely, definitely. And we do them right in the office.
Another aspect of an annual gynecological exam would be a pap smear, and recently those guidelines changed.
They have. They changed in 2009, and then they've recently changed again. Typically, a lot of women are used to every year having a pap smear, and nowadays we actually do it every 3 years. So age 20 to 29 does a pap smear alone every 3 years. Over the age of 30, it's every 3 years for just the pap smear, and if you're co-testing with HPV, ACOG recommends that you do it only every 5 years. Now those are new guidelines, and they haven't really trickled down to mainstream and everywhere, but as long as you have a history of normal pap smears in the past, and you have no new high-risk factors like new sexual partners, then it seems to be the way that we're going to be doing them in the future. And those are prone to change, but for now it's every 3 years unless you're co-testing over the age of 30, which would make it every 5. Now that being said, it's still important to come every year so that you can have the other aspects of the exam done, like the pelvic exam and the breast exam. But as far as the PAPs, those are getting spaced out.
And part of the motivation for these clinical changes are that the evolution of understanding of cervical cancer and the causative agent, which is this human papillomavirus. And so we know that if you are exposed to this virus, that there is a chance for progression to cervical cancer with continuation of active disease. Most patients, when they are exposed to this HPV virus, they will clear the infection on their own immune systems will get rid of this virus, but that doesn't happen in every patient. And typically it takes about 18 to 24 months from the time of exposure for clearance of the virus. But the lack of clearance is what leads to the progression to cervical cancer. And so the thought is, with spacing out these screenings, that we know that people, the onset of sexual exposure happens in the younger women, and so we want to give time for the exposure to happen and then to clear before you start aggressive treatment. Which would include cervical biopsies, colposcopies, and those sort of things, even unto removing part of the cervix to treat the abnormal skin changes. And this aggressive treatment has been shown to increase the risk for preterm labor. And so as a group, ACOG has really tried to back away from really aggressive treatment to avoid these potential complications for patients.
In addition to the frequency that's changing, when we do pap smears also has changed just recently. We used to do pap smears at age 18 or when people became sexually active, and now they're really saying we should bump that back to 21. And the rationale there is a couple-fold. First of all, we're doing not doing the PAPs until people are 21 because most abnormalities in that age group were the low-grade lesions. 90 to 95% of those are going to go away on their own. Like Nancy was saying, they're more transient and they'll go away on their own. And the other thing was, where Nancy was getting with, was people in this age group, they got abnormal pap smear. They had surgery for that abnormal pap smear, which shortened up that cervix. The shorter and shorter the cervix was, they were having problems retaining the pregnancy later. And even though this age group, they got abnormal pap smears frequency, the risk of cervical cancer, is very, very, very rare.
Well, you talked about pregnancy in this age group. Obviously, 18 to 39 is the majority of women will have children during that time period. What do women who think they may want to start trying to get pregnant need to do before that?
Well, one thing that you need to do is be on prenatal vitamins. So a lot of the times before you ever know you're pregnant, you're 4 or 6 weeks pregnant, and so some of the vital organs have already started to form, and especially the neural tube. So you need to be on prenatal vitamins that have folic acid in them to help to help with development of those organs and those structures. Something else that's important is every woman needs to look at her health problems, things like her weight, whether or not she smokes, how much alcohol and caffeine she's drinking, and that's a time to tailor those activities. So if you're smoking, stop smoking. If you're drinking in excess of caffeine or in excess of alcohol, obviously we don't want you to be doing that. Also, if you have chronic hypertension or diabetes, that's the time to get your blood sugars in check, get your weight at an appropriate weight for starting pregnancy. And also to check your medications. There's a lot of medications for chronic illnesses that women are on that really shouldn't be taken in pregnancy, that are category C, category D even. And so it's really important to address all of those things before you ever get pregnant. And that way you're keeping your fetus and you're keeping yourself as healthy as possible.
Another significant thing is to know your family history. And that is important because that's going to predict a lot of your risk for underlying inheritable diseases. And if you know you have a family history of birth defects or Down syndrome or even spinal bifida, Fragile X, any of these sort of muscular dystrophies, things that can potentially affect a pregnancy outcome, you want to be aware of that and plan ahead so that you can have a discussion with your healthcare provider about what sort of preventative actions can be taken, as well as what sort of diagnostic testing can be performed either before pregnancy or even in the early stages of pregnancy to know, is this particular pregnancy affected, or am I even a carrier for this process? Certainly patients can be screened for Fragile X carriers before conception. That can certainly be a relief to know that that's not something they even have to be worried about, because if they're not a carrier, then their pregnancy is not going to be affected. As well, the same is for cystic fibrosis. That can also be a very significant disease process, and people can be carriers and have no idea, yet their pregnancy could be at risk.
What are some of the most common concerns you hear from women who are pregnant once the pregnancy has begun?
When women are pregnant, they're always concerned about weight gain. We talk about that 25 to 30 pounds for a nice woman who's at a healthy weight to begin with. It might be a little bit more if they're starting underweight. It might be a little bit less if they're starting overweight. They're also worried about exercise. Can they continue the exercise? And usually what we say there is, you're okay continuing what you were doing. If you weren't doing any exercise at all, typically we get those people to start with walking. Walking 20 to 30 minutes 3 times a week, and gradually get it up to, get it up to daily, okay? And, the whole key is, if you're going to increase any exercise in pregnancy, you want to do it gradually. Also go over the type of exercise they're doing and make sure it's not, they're not putting the baby at risk with that, like you wouldn't want somebody doing heavy lifting in pregnancy and things like that. We also will go over, their risk factors. Really, are there issues from their health, from their history, from things like that, regarding the pregnancy.
Are there any other screenings, women ages 18 to 39, or other health issues that you hear a lot about, or that women need to know about?
I think that the STD screening that Dr. Collins was talking about is something that's very important on a yearly basis. As far as gonorrhea and chlamydia screening goes, the breast cancer screening, that's also important.
To go back to family history, that's also going to indicate at what point you're going to start some screening. Patients who have family histories of breast cancer in younger women, they may start their screening mammograms typically 10 years younger than the antecedent event. So, if their mother was diagnosed with breast cancer at 40, then they're going to start their mammograms about at age 30. If you have a significant family history of colon cancer, it may be an indication for you to have a screening colonoscopy at a much younger age, but that's all dependent on what your overall family history is.
And actually, another thing is just like risky behaviors, like smoking, excess alcohol use, things of those natures. That's a perfect time to touch base with those patients and kind of help them with maybe decreasing their smoking, the amount of smoking that they do, or the amount of alcohol that they're consuming.
I guess it's just important for patients just to talk with their doctors and be open with. Is that okay? All right, Dr. Lukowski, Dr. Collins, and Dr. Thompson, thank you so much for being with us. And don't go away. When we come back, we're going to talk about women's health issues when you're over the age of 40.
Conway Medical Center is truly bringing better health to life, and that's why CMC is Lauren Sawyer's hospital.
I went into labor on a Friday night, and we drove to the birthplace at Conway Medical Center.
CMC understands the unique needs and expectations of first-time parents.
Nurses were wonderful. They answered all of our questions, showed us how to bathe the baby and feed the baby, and they really made me feel good being a first-time mom. CMC is my hospital.
Reality. The reality of life can be described in many ways. But one reality has never changed. WPDE News Channel 15 is your choice for the most trusted news coverage. Our purpose, our spirit, the core of who we are has always been providing quality journalism. And the reality is, no one will ever match that.
Conway Medical Center is truly bringing better health to life, and that's why CMC is Anna Claire's hospital.
My mommy and daddy were born at Conway Medical Center, and so was I, and so were my little brothers, and I love the nursery.
For generations, Anna Claire's family has counted on CMC for all their healthcare needs.
Sometimes my grandfather, he goes there for heart problems. CMC is my hospital.
Welcome back to this Your Health, Your Decision special on women's health issues. Now we're going to talk about issues for women over the age of 40, the diseases that we should all be aware of, and the screenings we should all get. We are joined now by Dr. Brad Lineback and Dr. Terry Levinson. Thank you both for being with us.
Thank you so much.
Dr. Lineback, talk about some of the screenings women over the age of 40 should have, and what's important. What do we need to look for, particularly when it comes to breast health? We know mammograms.
Yeah, certainly mammograms. There's been some discussion as of late concerning mammograms and should you do it at age 40, should you do it at age 50. American Cancer Society and the American College of Obstetrics and Gynecology both continue to recommend beginning those at age 40 and doing yearly thereafter.
And why are those so important?
Well, the theory is that the earlier you can detect breast cancer, the better your treatment options and the better your outcomes. The survivability is improved at earlier stage detection. And this will not be true 100% of the time, but most of the time. So yeah, earlier detection is preferable.
One of the tools that you also have at Conway Medical Center would be the breast MRI. Talk about that and how that differs from mammography.
Breast MRI is a different kind of testing that uses magnetic resonance. You hear people get an MRI of brain or MRI of chest or abdomen. So it is a different modality. It's more expensive, but it has been used specifically in very, very high-risk individuals to complement mammography.
Moving on to another type of cancer, colorectal. When should women begin being screened for that?
Most people would recommend that you do that at age 50. Start with a rectal exam and a test for blood in the stool. Most people would recommend screening colonoscopies starting at age 50. And then depending on your risk, if you have a family history, you may need to be screened more frequently. If there are findings at colonoscopy, such as precancerous polyps, potentially removal of those polyps can save you the diagnosis of colon cancer later on. So depending on those things, if you have an absolutely clean history and a clean colonoscopy about every decade will suffice.
And we talked earlier about cervical cancer and pap smears, and some of those recommendations have changed. Is that true for women over the age of 40 as well?
There's been some discussion concerning doing HPV testing with the over 30 and spacing out pap smears. My personal opinion is that a yearly pap smear covers a lot of things, i.e. yearly breast exam, yearly physical exams that otherwise would get missed. And so I'm less inclined to go with the every 3 year and more inclined to continue with every year that we've been doing, both Dr. Levinson and I, for years and years.
And it's harder to keep up with something you do every 3 years or every 5 years or every 10 years. Having said that, you know, with the advent of electronic medical records, it makes it a little bit easier to do those sorts of things. Unfortunately, a lot of women have decided that, as Dr. Lineback was alluding to, since they don't need a pap smear, they don't need to come at all. So that you miss the opportunity to intervene with other screenings, with other physical findings and other potential issues that may get missed. A lot of women think if they've had a pelvic exam, they've had a pap smear. And what I try to explain is that the pap smear is a laboratory test. It gets sent to the lab, it gets interpreted, and it comes back. So I think it's still important to be seen on a fairly regular basis. Pap smear may not need to be done every year. If you've had a hysterectomy, you probably don't need to have a pap smear unless the hysterectomy was done for some sort of cancer, in which case you would still need some sort of interval screening.
And that's for cervical cancer. What about ovarian cancer? Screening
for ovarian cancer has been a very frustrating issue for obstetrics and gynecology going back decades. I was thinking about this the other day. In the 30 years that I've been in practice, it seems like for the last 25 years, articles will come out and say we're this close to having a test, but so far it hasn't happened. There is no screening test that will detect any precursor to ovarian cancer. The other problem is that currently the theories about ovarian cancer are that the very early stage ovarian cancers probably are never going to become late stage cancers, and the late stage cancers, the ones that have spread throughout the abdominal cavity, probably arise that way. A current theory that we were talking about earlier has to do with the possible origin from the distal end of the fallopian tube that's next to the ovary, and that it starts there, spreads to the ovary, bowel, the appendix, the other peritoneal surfaces, and so there is no opportunity to intervene early on to catch this at an early stage when it's more treatable.
You mentioned some of the other screenings that you would perform in an annual exam. That would probably include, I guess, blood pressure, that type thing. Why are those so important?
Well, you know, as we all know, blood pressure, diabetes, those are very significant health issues in society today. And, you know, that goes back to the yearly exam, and frequently women's only contact with a physician is one with their OBGYN. We are basically their primary care physician. And if they're not coming yearly and doing these things, those will not be picked up. Certainly, you know, there are those families with high risk for heart disease, hypertension, et cetera, that lipid screening is reasonable. Certainly there are recommendations of lipid screening from age 45 on. Earlier than that, with family history of early heart attack and diabetes. So, you know, those are things that allow us to be primary care physicians, which we are, and screen for those things.
Yeah, you have to think of these kind of things as long-term management. These are not things that will hurt you tomorrow or the next day, but you need to intervene now so that 20 years from now you don't have kidney failure, stroke, heart attack, so forth and so on.
When women reach the age of 40, of course, you automatically start thinking about the big change coming in menopause, but actually we go through perimenopause first. Talk about that and what those symptoms are and what that means.
You know, women when they reach sometimes in their 30s, but usually in the 40s, frequently ovulation does not function as well as it used to. And production of progesterone as a result of ovulation is not as good as it used to be. And that's where you find ladies who begin to have potentially hot flashes, irritability, memory issues that you notice, and we're talking about minor things, but treatable things. And you know, it's not necessarily age 52, which is the average age of menopause. I see a lot of ladies that are in their 40s with those symptoms that are treatable and amendable.
Yeah, a lot of women will start having these menopausal symptoms before they stop having periods. An article came out this year that was basically they looked at a large number of women over about 20 years, and what they determined was the earlier your symptoms start, the longer they seem to last. So if you start having hot flashes 2 or 3 years before your periods actually stop, you can look to have them for quite a long time.
And menopause is actually once your periods
stop. Yeah.
Okay. All right. Are there any other screenings that women really need to think about having every year or every few years that are recommended over the age of 40? That we
do a lot of bone density testing. With the onset of menopause, the calcium balance in the skeleton goes from positive to negative, and you start losing calcium from your bones. Women develop osteopenia, which is the precursor to osteoporosis. And again, it's a long-term management sort of thing. And there are some reasonable guidelines for looking at, or the intervals for looking at bone densities and treatment and so forth. It seems that a lot of people are afraid of the medications that are used to treat osteoporosis and osteopenia, because there was a lot of press about them, but the fact of the matter is that most people tolerate these drugs very, very well, and they're very effective, and they do prevent things like hip fractures. An 80-year-old woman who fractures her hip will have about a 50% mortality rate. So half those women will die from complications of that, which is way higher than breast cancer in that 80-year-old woman.
Then I think current recommendations are to begin that at age 65, and unless there are risk factors, which are smoking, thin stature, high-risk fractures like somebody falls and breaks wrist. Those are things that are consistent with osteopenia, so that would necessitate doing it a little bit sooner.
All right. Dr. Brad Lineback, Dr. Terry Levinson, thank you both for being with us.
Thank you so much.
And that will wrap up this Your Health, Your Decision special on women's health issues. You can always get more information on CarolinaLive.com.